Thank you very much, Chair. Interestingly enough, in this legislation, it talks about a universal single-payer system. So can you explain that a bit, and not in your usual, ongoing fashion that you like to do, but can you simply explain that to Canadians and what that might mean?
Sure. It means that somebody is going to be able to get the drugs that they need without having to pay.
Okay, great, interesting. So if somebody has pre-existing coverage, and my colleague talked a bit about this through their employer, this program, why would employers continue to offer their employees a program if this is going to exist?
So employers offer much more coverage than we're contemplating here. This is a very, very tiny sliver of what employers offer. So I can tell you from negotiating these things that there is not the opportunity to go a la carte. And if you try to pull out a tiny fraction, you're not going to save very much. And what you're going to show to your employees is that you're not serious about them. What I've seen from the insurance industry is that they're very anxious to maintain their coverage and their business. And what I've seen from employers is they're anxious to make sure that their employees continue to get coverage.
Really, again, you just have to go on and on and on. Maybe you could just try answering the question instead of your political grandstanding. So that being said, though, what you've now said is that what you've created is a very basic, inferior program on behalf of Canadians.
True.
So I find that absolutely interesting. Built into this bill, you talked about the creation of the Canadian Drug Agency, which I understand should have been stood up around May 1st, which is something actually in your purview as the Minister of Health. So I'll give you kudos on that. Given that you could have actually had created an agency which has significant oversight, which maybe you don't realize it should have, because the approvals that are actually done through the process, including Health Canada, PRB, the new CDA, PCPA, et cetera, are the worst, some of the worst at least, maybe not the worst, some of the worst in the country. So you could have actually changed that with this legislation, but you chose not to. Can you tell Canadians why they're going to be left out in the cold waiting for new medications?
Well, they're only going to be left out in the cold waiting for new medications if you're successful in stopping them from getting their medication in the first order. In the second order, Health Canada is known around the world, not only for the rapidity with which we approve applications, but the quality. Canadians should feel very proud, not of me, but of our health officials who every day do extraordinary work to make sure that the products and the medications and the food that they consume is safe. And I think that to cast any shadow on that would not only be not connected to fact.
I think that what I asked you about was the Canadian Drug Agency and why you didn't put some oversight into this bill with respect to the Canadian Drug Agency. It's not my plan to stop Canadians from getting drugs. You're the one who would be responsible for having some oversight of the CDA, which you do not have. Why did you choose not to do that on behalf of Canadians?
I would say that through our existing mechanisms, we have very strong oversight, and that we are recognized as being one of the best regulators in the world, and that when people look to approvals done by Health Canada, that they know that that is a gold standard to which other countries look up to. And I'm extremely
Minister,
proud of the people that work in our public service every day to do
that were
that.
Brought forward from 2012 to 2021. The Canadians would only have access to 44% of those. You think that's okay?
I think that we have to be.
Yes or no, Minister? Is that okay or not?
Well, you don't get I don't get to dictate your questions. You don't get to dictate my answers.
Yeah,
and
the answer is a simple yes or no. Is it okay? Yes or no?
The answer is that when we approve medications, ensuring they're safe and ensuring that people aren't hurt,
is it okay
making sure that they don't injure people's health is a hallmark of Canada's drug approval system that I'm deeply proud of.
And all you choose to do is continue to talk, which is,
well, I don't know. You don't seem to want to let me answer. You have
interesting.
Point of order.
Mr. Julian on a point of order.
I think the tradition around this table has been when you ask a question, wait for the answer. I would appreciate it if we could get the answer.
He can reclaim his time.
Dr. Ellis is correct, but there have been violations by both the person posing the question and the person answering the questions throughout this round, quite frankly. There's about a minute left in your turn, Dr. Ellis, if you want to share with Mr. Steinley, or if you plan to.
That's correct, Chair. The rest of the time is for Mr. Steinley. Thank you.
Okay.
Thank you, Mr. Holland. Did the Minister of Saskatchewan ever ask for dental care or pharma care from your government?
I think they've asked a lot of questions about how we can work together and on dental care, and those questions have been productive. I've expressed to both jurisdictions that if they wanted to operate those
Did they
programs
ask you
provincially, as long
to
as they were at the
step in
same
their
cost and
jurisdiction
same
for
quality,
that?
that I would be.
They didn't ask
I
for you,
have
Bowtie.
From the Minister of Health, we've never asked the feds for dental or pharmacare. So is he not telling me the truth, or are you not telling me the truth?
Well, I don't. I mean, you can ask him whether or not he wants dental care or not. I mean, dental care
No, I
for
said,
9
did they
million
ever
Canadians
ask
is
for
coming.
it?
Well, I can tell you that, and I've had
Oh,
very
it's
good
coming.
conversations.
We're
going
gonna
to I have an
overreach
enormous
into your
amount of
province
respect
no
for
matter
him.
what.
He and I have sat down and talked. It's about how we can work collaboratively.
And one more quick
He's
question
never
for you.
said to me that he doesn't want dental care for people in Saskatchewan. If
They
he
said
said
they
that
never
to you,
asked
that's
for it.
not.
One more quick question. Do you know how much coverage we have in Saskatchewan right now when it comes to diabetes, the diabetes programs in Saskatchewan, and the senior drug program in Saskatchewan, what the coverage is?
Yeah, no, I think, Saskatchewan has done a good job. They have
you
a
tell me
good
what it is?
program. There's still a lot of gaps, and there's a lot of things we can do together, and Everett and I have talked about those gaps
He
and about
doesn't
how we
even
can
know
improve
the
them
Just
and
want
make
to
sure
tell
that
you,
everybody
that's
has
already
tell me what
existing.
age is covered in
underrepresented.
Saskatchewan
But I
for
think
diabetes.
I would commend Saskatchewan for the work that they've done, and I do agree that
that's all
Everett
your
has done a good job as a health minister.
Okay. Thank you, Minister. The